CHIS is a very large survey that we do every 2 years in California in collaboration with the California Department of Public Health, the California Department of Health Care Services, and the nonprofit Public Health Institute. We conduct CHIS every 2 years in order to take a snapshot, a picture, of the health and healthcare needs of Californians. And we provide that information from thousands and thousands of interviews that we conduct to everyone who's involved in trying to improve the health and health care of Californians. It's been used by state policymakers to improve access to food for low-income families who've been shown to be at risk for hunger. It's been used by United Way agencies throughout California to help them make decisions about where to put their resources to help the most people. It's been used by the state and by counties to try to improve access to health insurance for children throughout California to ensure that they have access to the health care they need to grow into healthy and productive adults. Basically, CHIS data are used all over the state to improve the health and the lives of Californians.
One of the really powerful aspects of CHIS is it recognizes that California is not a monolithic state. Indeed, we are a state of regions, we are a state of communities, and our policy approaches, our policy making, our program administration needs to reflect the diversity of California. CHIS makes a really important contribution in that effort because it's not just statewide data, it's also regional data, it's local data. It provides a level of detail that enables policymakers really at all levels of government to better understand a problem, and in so doing to develop more appropriate and targeted policy responses. Information is power, information is relevance, and CHIS is powerful and it is relevant because of both its statewide nature and its more localized nature. It's reflective of the diversity of California, and it helps inform appropriate decision making and policy making as a result.
One of the reasons that CHIS has such impact is because we go to a great deal of effort to provide data to people who can use it in their work. We conduct workshops all over California to introduce CHIS data. We help them learn how to use it and how to access it and apply it. We put a lot of effort into disseminating CHIS data because we think it's really important to making sure that the CHIS data are used to improve health and health care.
CHIS plays a very important role in the work that we do at the California Endowment. Our mission is to improve the health of underserved communities and populations. We like to say no stories without numbers and no numbers without stories. The stories are the examples of successes that grantees on the ground in these communities deliver in terms of better outcomes. But that has to be backed up by data. We need numbers. We need to know what the situation is, how desperate or significant are the disparities and issues. We need to have folks that are going out into the field, talking to people in underserved communities, what's their situation, translate those stories and information into real hard data so we can tell the story more powerfully.
CHIS came out of the recognition by myself and by a colleague in the state health department that there was a real need for data that simply wasn't available that could provide information about the health of people at the local level in California as well as statewide. Data that reflected the tremendous ethnic, racial, and other social diversity of Californians. And we were able to get generous support from the California Endowment, from state agencies, and from the legislature because many of these groups realized that having these data would be a powerful tool to promote evidence-based health policy in California.